of India in J&K. The reports are prepared on behalf of the Comptroller and Auditor General. So in J&K, our office prepares the audit reports, gets them approved, and then they are laid in the UT legislature. Yesterday, the 7 reports were laid by the Honorable CM as Finance Minister. 1 report was laid earlier, and I'll give you some details here. These 8 reports you can see have been laid before the legislature, and this will be now discussed by 2 committees, the committees of the legislature. There are 2 committees. One is called the Public Accounts Committee, other is called the Committee on Public Undertakings. So these reports will be discussed there, and then the representatives of the departments will be called. They will be asked to give replies, and then the committee will come to a conclusion. Our job is to get the audits done, present the reports in the legislature, and the committees will discuss. So you can see 8 reports have been laid recently. One is on the finances of the UT. So if somebody is interested in how good the government is doing on the finances, the first report refers to that one. Second is on the health structure of the UT. So as you see that there was this COVID pandemic in the country. After that, there was an assessment of the health infrastructure in various states and also in J&K. So this gives a brief of the health infrastructure in J&K. The third one is on the University of Jammu. You know there is one university in Jammu. This is a full report, one report on the working of the university. The third one is on the lakes. J&K has a lot of lakes, about 700 lakes are identified. So the report is about what the government is doing about these lakes, whether the conservation and management of lakes are proper, whether the lakes are shrinking or becoming bigger, whether there are encroachments. So you can have we have one report on that. Then there are reports on the PSUs, as he said, public sector undertaking, some issues regarding that. Then there is one report on direct benefit transfer, solid waste management, and CRIF. CRIF is the road fund, central road fund. A lot of money comes through the CRIF for construction of roads in the UT. Then one report on JTRP, Jalam Tavi flood recovery project. PMKKY is the Khanij Kalyan Yojana regarding the benefits to be given to the mining affected people in mining affected districts. Then there is one on NRLM, the National Rural Livelihood Mission. The last report is on the revenue report on GST and e-way bill. So we'll give you the brief of the reports. As to give a little bit detail of what these, one report on, as I said, one report on the health structure, health infrastructure in J&K, although it is a very big report. But if you see, for example, you can keep this. On this slide, you will see some issues like human resources, service delivery, infrastructure, and finance. But in the main report, there are 12 chapters. So first chapter, for example, on human resources, gives a lot of details on what is the human resource structure of in the health sector in J&K under various like Ayush or NHM, or in district hospital or sub-district hospitals, or in community health centers, or in the tertiary health sector. So if you see this first chapter, you will see that only 67% of the human resources are available. For example, this is just an idea, but you can get more details in the report. Then shortfall, for example, the shortfall of human resources range between 11% and 43%. This is the range. And in under NHM, there is 19% shortage of doctors and 16% shortage of nurses and paramedics, 8% shortage. So this is just a gist of the report, but you have a very long chapter on the human resources in this report, giving doctor population ratio, human resources under Ayush, human resources under NHM, in the Medical Supplies Corporation, and human resources in the sample district hospital, tertiary hospitals, and sub-district hospital. Everything is given in this chapter, because human resources is the most important part of this health sector. In the service delivery chapter, you can see here in the chapter number 3, there are 13 types of services which should be available in each hospital, whether it is a district hospital or sub-district hospital, like emergency, OT, blood storage and on. So we have given details of whether these 13 services are available in these hospitals, whether it is a district hospital or a sub-district hospital or CHC, PSC, or even in the tertiary, means the bigger ones. Is a very interesting report on the management of lakes. As we said, J&K has about 700 lakes, out of which we test checked 63 lakes. Test check means we went through them in detail, what happens to these lakes. 6 of them are the major lakes like Dal, Wular, Hokarsar, Mansar, Surinsar and Manasbal. So a lot of details are given about these 6 lakes in particular, but also about 63 lakes out of about 697. Like you can see this report, it is a very detailed and beautiful report. If you can see, if I can open this report here, GIS remote sensing data to assess the area of the lake and whether it is going up or down. For each of the lakes we have test checked. So you can see here whether this remote, from the remote sensing, we can see whether the open area of the lake is going up or down, whether the built up area is going up or whether the vegetation part of the lake is going up or down. You can see for all of the lakes. You can see here for 2014 to 20 how the lake is, each lake, the area is being changed. It's called the land use change in the lakes. We can see whether the lake is shrinking or it is becoming better. So this has a lot of GIS. You can see these reports here. Generally, we found for the lakes there is no centralized regulatory authority. There is no centralized agency to look after the lakes because there are about 700 lakes. So mostly they are under the forest department, but there are developed authorities also. For example, for Wular and Dal Lake there are some special authorities, and some are with the revenue department. So we can see there are 5 departments looking after some parts of the lakes. There is no centralized policy, there is no centralized agency to look after the lakes. So as long as there is some program going on for some lakes like Dal Lake and Wular Lake, they are okay. But for the rest, it is nobody's baby type of situation. So here we have said conservation programs existed only for 6 out of 697 lakes. The rest are left to themselves. Significant land use changes across 63 test check lakes means that water part of the lake is shrinking. So you can see the details here. The built up area, the agriculture, horticulture, pasture land part of the lake is going up. So either the vegetation is growing up or people are building more built up areas around the lake. 7 lakes are not visible. They are supposed to be there, but when we check them physically or through the GIS, they are no more there. You can see the details of these 7 lakes. And then for the lakes, there should be catchment evaluation, water carrying, gauging of water carrying capacity, water budgeting, flushing, biodiversity preservation. All these should be done for each lake. Otherwise, naturally they will die because of human activity. But these are not available in the lakes except for the 6 lakes as we said. For example, in Dal Lake, there is a full chapter on Dal Lake. You can say it's a big chapter. And we have given a lot of details on the Dal Lake, giving the history of the lake, how big it was once upon a time and how it is becoming small or larger. In the first itself, we have said there is a change in land use, becoming smaller or bigger, you can see in the report. Then there are 6 STPs, sewage treatment plants in the lake, supposed to treat the water going into the lake. But we found that these STPs are actually not working. They are polluting the lake more than treating the lake. And in other cases like inadequacies under an NLCP, the National Lake Conservation Program, and PMRP, these programs for the lake actually involved removing relocation of the household, connecting the sewer networks of the areas, the built-up areas within the lake. These are actually not happening. For example, the realignment of the houseboat and shifting of the hotels around the lake, or people from inside the lake, they were supposed to be shifted outside the lake. They are not happening. And then catchment area management. The catchment has to be treated so that water comes has to be clean.